Happy Saturday morning, VOB! If you're not getting up out of your bed, it's just in time for 15 diabetic-friendly minutes, all with the compliments of the Barbados Diabetes Foundation. And of course, you're probably wondering what is coming up in today's show. Well, I'm wondering too. So I asked Dr. Braffett, Dr. D, what are you talking about in today's show?
So this weekend, we're going to talk a little bit about feet once again.
This will be a feet show this morning. Everything you ever wanted to know about feet but were afraid to ask. Including, we will also hear from podiatrist Louise Robinson.
So podiatrists do a lot more than just cutting nails.
What is the lot more that podiatrists do? All this and more coming up in today's show, all with the compliments of the Maria Holder Diabetes Center, the Barbados Diabetic Eye Screening Program, and the bank that keeps you on your financial feet, Republic Bank.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
If you are diabetic or pre-diabetic and you need diabetic services, but you need to make your dollar stretch no further than the Maria Holder Diabetes Center. For vascular, podiatry and diabetic eye screening services or consultations with diabetes doctors and nurses, call 417-0305 today. The Maria Holder Diabetes Center, located in Warren, St. Michael. They can save your life and save you money, but members get 10% off.
This is Peter Boyce here, morning again. I am here standing on my feet as I welcome you to this foot theme show that we will be having this morning, where we will also be focusing on wound care. You already know how important feet are to diabetics. In fact, feet important to everybody because you need your feet to move around. So that means everybody should be taking a listen to this important topic that we will be dealing with this morning, to what Dr. Diane Braffett of the Maria Holder Diabetes Center, what she will be saying. Morning, Dr. D.
Hello, Barbados. Hello, Peter. Hello, Alfonso. I'm going to call you Soko Alfonso for now.
Yeah, that's me, Soko Alfonso. I can live with that.
Happy crop over season to everybody out there. I hope you're being safe, still having fun, but being safe, and as always, protecting those feet. So this weekend, we're going to talk a little bit about feet. Once again, we're always on about the feet. I think firstly, we're going to just talk a little bit about wound care and the wound care experience at the Diabetes Center. And then we're going to have a few words from the podiatrist, just sharing a little bit more about what podiatry entails, what podiatrists can do. And we're going to get into discussing a new area called biomechanics and orthotics. And this is an area of service that we're expanding at the center, and it is actually also available to persons who are not living with diabetes, but we're gradually going to try to teach persons a little bit more about what exactly it is, what it entails, do you need it, that kind of thing. So let me talk a little bit about the wound care experience here. So wound care, especially when you're dealing with somebody who's living with diabetes or somebody who's older, should be what we call a multidisciplinary type of experience. And what that means is you may have care providers who are interested not just in your wound, but they're going to be interested in your general medical health, maybe a nutritionist who may suggest ways in which you can boost your nutrition to promote wound healing, and if it is that you need an educator to help you improve your blood glucose control, something like that. So I think the important tenets about wound healing are that you need an environment that promotes healing. And what does this look like? It looks like an environment where you're getting enough blood going to it. It looks like an environment where swelling is controlled, an environment where there is not infection or what we call overcolonization with bacteria, meaning not too much bacteria on the wound surface. And then of course, if we're living with diabetes, an environment where the blood sugars are not elevated. When you're living with diabetes and your blood sugars are not controlled, wounds do not heal easily. This is why control is so important when you're dealing with the wound. It's not just about putting a dressing on the wound. So I like to describe wound care as being a holistic experience where you look at taking care of the whole body, getting the whole body into optimal kind of situation for wound care, and then you deliver the dressings that are needed on top of that. Sometimes dressings have to change, and it may depend on what the wound is doing. Is the wound putting out too much fluid? Does it have maybe a little bit of dead tissue that needs lifting up in one way or another? We're not going to get into details on wound care today, but I think what I want to stress is that importance of the holistic care, and not just the holistic care in the center when you come here, but also at home. When you go home with your dressing, you've got to take care of yourself, your dressing, and your foot. Don't go getting your dressing wet. Don't go trying to bathe a little plastic bag on your foot and you think it will be dry, and then you get your dressing wet, and then you come back maybe with an infection or an overgrowth of bacteria in it. Keep your dressings dry. Find out from your care provider, do I keep my foot down? Do I elevate my foot? Figure out, am I allowed to walk? How much walking can I do? If I am walking, do I need a special type of shoe to walk in, or should I be walking on a frame? Should I be resting? Many things will differ depending on what type of wound you're dealing with, and also what else is going on the foot, where it is the wound properly offloaded? Do you have a correct shoe to take the pressure off of the wound? Remember, if you have a wound on your foot and you're walking on it, obviously if you're walking on a cut, it's not going to heal as quickly. But once again, all these things depend on where the wound is. Okay, so, and then finally, the number one thing is, please don't go and squeeze your foot into a shoe that it should not be in with a dressing to go and do something. You're actually possibly going to end up injuring your wound further. One or two bizarre things that we've seen as well is people taking a hair dryer and then drying a wet dressing and then coming back, unfortunately, with burns that were created from the steam that was generated by the hair dryer and the wet dressing. So please be very careful. Sometimes I tell people, if the dressing got wet, just change it into simple gauze dressing and contact your care provider as soon as possible. So I hope this has been helpful for you, so you can think a little bit more maybe about some of the questions you should be asking your care provider if you're living with diabetes, or if you're living with peripheral artery disease, which is reduced blood flow going down into the foot. Maybe just some more questions so you have a better idea as to how to take care of your wound, and also to deal with your dressing and what kind of shoes you should be wearing, and a level of physical activity. We're now going to move on to a very interesting contribution by Louise, and we definitely have been seeing more people asking about this service, and I think that we're also screening a lot more for people who may need what we call orthotics, or may need further biomechanical assessments. So happy crop over weekend, pre-crop over weekend.
Happy crop over weekend to you too, Dr. D. As we continue to focus on feet today, we are now tiptoeing over to podiatrist Louise Robinson for her foot contribution.
So podiatrists do a lot more than just cutting nails. We go to school for 4 years in the UK, and we're healthcare professionals that would specialise in the diagnosis and treatment and prevention of conditions that affect the foot and the ankle and the lower limb. We can provide a wide range of services, from routine foot care to some surgical interventions such as toenail surgery, and we play a vital role in managing foot and ankle issues which relate to various health conditions such as diabetes and arthritis. However, one particular treatment that we do, or intervention, is biomechanics, and that relates to gait and how we walk, and as a human being, how we move.
Tell us some more about how you assess gait and walking, Louise.
As a podiatrist, how do we measure gait and an individual's walking pattern? So we obviously like to observe the whole body walking, and we usually ask you to walk barefoot. That shows us where your pressure points are and your stride patterns, and that will help us to decipher whether you're overpronated or pronated, and where your stress fractures are in your feet, in your ankles, in your knees, and in your hips.
As we continue our foot theme show this morning, reminding you to take those feet to the Maria Holder Diabetes Center for podiatry care and wound care, located in Warren St. Michael. If you are diabetic, or even if you're not diabetic but might have foot issues, that's where you should be taking those feet. And feet also need shoes, so this is a shoe song this morning, a calypso as it is called, hop over. This is the Mighty Sparrow with Dancing Shoes. Compliments the Maria Holder Diabetes Center and Republic Bank.
Working hard, so hard to find the money. I'm feeling glad how I now get paid. You always find how I working to stay, and I don't care you how to romp and play. All that got changed up now. This is one thing I found. No more fight and row. We had the money now. Put on your dancing shoes. Shake out your navy blues. It's time to bump and cruise. We're gonna party in your dancing shoes. There is no time to lose. Come baby, light my fuse. We're going out and party in your dancing shoes.
Please don't go and squeeze your foot into a shoe that it should not be in.
The Maria Holder Diabetes Center.
We are almost at the end of our show, but Dr. Buffett, you got something else to add?
We'd also like to just let everybody know we are embarking on an interesting initiative with the Barbados Council for the Disabled. And at this juncture, at this point in our partnership, we are offering some free health screening for persons living with disabilities or their immediate families. And that health screening will involve a health history, blood pressure check, a total cholesterol check, and of course, the proverbial HbA1c and a fasting blood sugar if you're able to fast for the testing. If you are interested or you know somebody who would be a good candidate for this, especially if they don't know if they have diabetes or not, they can contact us at the Barbados Diabetes Foundation. That would be Lisa 417-0305, or contact the Council for the Disabled and leave your name with one of the staff members there. Thank you. All visits will be by short appointments, and there'll be various dates running throughout the rest of July and August for this initiative.
In 2025, the Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening, vascular screening, and podiatry services, offers a standard of diabetic services that equals or surpasses any you might receive internationally at a price that everyone can afford. So if you are diabetic or pre-diabetic and listening to VOB right now, call and make an appointment to get your eye screened for diabetic retinopathy by calling 243-3937. Or if you are having vascular or circulation issues or need to see a podiatrist or nutritionist, call 417-0305. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center. Until next time,
reach for that extra glass of water. That is the smallest thing that you can do to make the biggest impact on your health.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100. Or members get 10% off.
Dream a dream and watch it become a reality. You can do